Okay, good morning, everybody. Thank you so much for being here with us today. My name is Katie Earle, and I'm the coordinator of the University Express program, and I work for the Erie County Department of Senior Services, just like my colleague, Bill Daniels here. We're really grateful for his time this morning, especially on a topic like this when there's so many things to consider. So, Bill, thank you for being here.
Thank you, Katie. Thanks for inviting me.
You're welcome. Before we jump into his presentation, we do have some new folks, so we'll just go over some housekeeping things. First thing is, you just heard me say we are recording this session, and I will try to post it online on our website, maybe today, maybe tomorrow. We'll see when that's ready for us. But you may have already noticed that you've joined muted and without your video showing, and there's nothing you can do about that. You have not done anything wrong. Those are just the settings of our program. You also might think that you're the only one here with Bill and I today, but as you've heard me say, we have others, just that we're in anonymous participation mode, so only Bill and I know everybody who's in here. So throughout Bill's presentation, if you have any questions or comments, please feel free to type those in our Q&A panel as soon as you think of them, and we'll try to get to as many at the end of the presentation that we have time for. So for our new folks today, how do you access the Q&A panel? Well, when you join, chances are that panel popped right up on the right-hand side of your WebEx screen. You may just have to hit that little caret to expand it. You'll see your text box. Send your questions right to me. If you're not seeing that, if you look at the lower right-hand side of your screen, you'll see a half circle with a square and a question mark in that box. That's your Q&A panel. And if you've joined from a tablet or smartphone, tap or touch your screen, your control panel will pop up. Click on that circle that has 3 dots, and there's your Q&A panel. So we hope you participate, and I'm just thankful that you're here. So I'd like to thank the sponsors of our program, which is our Department of Senior Services, Blue Cross Blue Shield of Western New York, Excelsior Orthopedics, and Wegmans for all they do to help make this program possible. And as Bill's going to talk about, please do not hesitate to contact us at Senior Services if you have any questions at all about programs, services, benefits for yourself or a loved one. We are happy to help. We're at 858-8526. So, Bill Daniels, everyone. Bill has been serving as the coordinator of the Insurance Outreach and Counseling Program since 2006. He is certified by New York State Office for the Aging as a health insurance counselor and has been counseling Medicare enrollees regarding health insurance options since 1995 through our Department of Senior Services Information and Assistance Unit. Bill, take it away.
Yes, good morning, and thank you everyone for joining us. Medicare is a federal program that was established during Lyndon Baines Johnson's Great Society. It took 2 years to get through Congress. There was a great deal of resistance to it. It is one of the 4 most expensive federal programs, the others being Social Security, Defense, and the National Debt. So it's always been under attack and scrutiny. So it took 2 years to get through Congress. In order to be eligible for Medicare, you must be age 65 or older, or receiving Social Security disability. Most people receive Medicare if are disabled after 24 months, effective the 25th month, with the exception of people that have end-stage renal disease or Lou Gehrig's disease. There's 3 parts to Medicare. There's Part A, which covers hospital care. Part B, which is for skilled care. And Part D, which is for drugs. Part D came into existence in 2006. You're not able to get prescription drugs under Part A while you're in the hospital or for Part B. Part B meds are usually for infusions given in a doctor's office, and there's a 20% co-insurance. Part A has a trust fund. So if you hear advertised Medicare going broke, it is a trust fund that might be exhausted. Part B, most people pay 25% of the cost of running the program. 75% is picked up by general tax revenue. And then there's Part D for drugs, which is roughly 25% paid for by the people that have it, 75% of the general tax revenue. Okay? I should say this is a government service. I do not sell insurance. It's paid for by your tax dollars. Okay? And I cannot choose plans for anyone. If you ask us, I will walk you through it. And now I'm having a technical problem. Katie? Hey, Katie. Okay, nope, I got
Yes,
it.
Bill?
Okay, I got it somehow. It was just slow. Now, there's major gaps in Medicare. For example, under Part A, the first day hospitalization is your responsibility. And it's roughly $1,400. It's a national average. It's about roughly $1,408 for this year, 2020. Part B has a deductible, which this year is $198. And there's co-insurance of 20%. Part D, the premiums vary from plan to plan. They could be zero, or it could be up from there. There's 48 different Medicare Advantage plans that have Part D, and 28 plans where you just get your prescription drugs. I would not advise anyone to just have Medicare alone, unless you are a veteran and you're satisfied getting your services from the Veteran Administration. Major problem with Medicare is that there's no cap to out-of-pocket expenses. And that could be very expensive. Hey, can you advance this?
Yes, you just got to tell me when and I'll do it.
Okay. Next one, please. Okay. Next one. Thank you. So you want to always try to fill those gaps in Medicare. First option, you purchase a plan based upon employment. Now, I've been doing this work since 1984. Back then, I might find 50–60% of people having insurance from their previous employer. As healthcare costs have been gone up, especially for the Medicare population, less and less people are able to get health insurance from the previous employer. Or if they could, the costs are too high. So it's not available to most people. And that's your pretty much of the union. It's pretty much non-existent. Next slide, please. Okay. One way of filling the gaps is to get a supplemental plan. Now, the supplemental plan, Medicare pays first, and the supplemental plan pays second. So, if something from your previous employer, which could be Medicare Advantage, it could be a supplemental plan, you get it from the union. The supplemental plan is going to pay second. Medicare will pay first, these plans pay second. On your screen, it shows a website. You look at the different plans, what they cover, and what they cost. So it's the World Wide Web, www.dfs, Department of Financial Services.ny.gov, or pursue more information for the current rates and plans in your area. Okay? So that's why we fill in the gaps. The other one is a Medicare Advantage. Now, these plans are different than original Medicare. They're very popular in this area. They're advertised extensively. Plans in this area are all what they call risk plans. In other words, that the plan assumes the risk that Medicare would normally have. Approximately 60% of people in this area have a Medicare Advantage plan. Medicare doesn't pay your claims. The plan is responsible. It must offer you additional services besides original Medicare. Many will offer you a prescription drug plan that's better than the standalone Part D plans. They will offer gym membership. They will offer, some of them will help you pay your Medicare Part B premium for 2021. So it's a different approach. You're not getting your benefits from the government. You are getting it from a private company. When these plans first came out, Medicare was funding them at 95% what it cost the government to run Medicare. According to an article in the Buffalo News, they're now getting up to 101%. The government likes these Medicare Advantage because one of the problems with Medicare is fraud. Medicare must pay within 30 days, and a lot of times some of these people have gotten their money and ran with your tax dollars. So the Medicare Advantage is smaller, and they control their losses better. But you would not get your benefits from original Medicare. If you look at the ads on a small print, they'll say they have a contract with CMS. Stands for Medicare and Medicaid services. You get all your benefits from them. But since they get a set amount of money per month to assume the risk, they also have a tendency to be pretty rigid about what they cover. Okay, so you want to make sure it's a well-rated plan. Now, how do I advance this, Katie? Thank you. There's different models under the Medicare Advantage. One is your HMO model, health maintenance model. We must tell you the model when you buy the plan. That restricts you to a network of doctors and hospitals with whom the insurance company has a contract. You must go to them. Unlike original Medicare, you can go to any provider who takes Medicare. On the HMO model, you must go to one that has a contract with them. The exception of emergency or urgent care. Urgent care being defined as if you did not get treatment, it could become an emergency. For example, someone has diabetes, might be down in Florida, they're out of the network, that might be considered the urgent care. So the insurance company could do that. And they'll pay you up to what's considered customary and reasonable in this area. Let's go to my next slide. Yes, a preferred provider model, that allows you to go out of network. It allows you to go to any doctor anywhere. Since these insurance companies are getting a set amount of money from the federal government, they like to maintain as much control as they can. Under the PPO model, they don't have as much control. So there's a good chance that you could be paying more with a PPO than you would if it was an HMO model. A private fee-for-service model basically deals with the way that the doctors are getting paid. Under original Medicare, the more the physician does, the more the physician gets paid. Under your managed cares, they might get a set amount of money, regardless if they see a patient or not. They might get maybe $40 for every patient in the plan. That's more common with specialists. Or they might get paid on what's known as withholding. And that's where the insurance company says, all right, doctor, we'll pay you $100, but we're going to give you $80 today. And we'll give you the additional $20 when we make our profit that we anticipate making. So it makes the doctor a partner with the insurance company. It's all about the money. Okay, as I mentioned earlier, Medicare and Medicaid is very expensive for the folks. With your private fee-for-service, the insurance company has a medical director who determines what's reasonable medical care. And a lot of times they'll have approval.
Right. So under your private fee-for-service model, you go to doctors, get paid according to how much care they provide. And that's popular with the doctors. Also with the private fee-for-service model, you don't necessarily have to get your prescriptions from the insurance company. You can get it from a standalone plan. Next one, please. Medicaid. Now, for Medicaid, you have to have low income and low assets. It's basically expect you to live below the poverty level, and the resources are very limited. If a person is disabled, they could put excess income into a trust. called a pool of trust, and that allows them more income and resources to live on. But those are basically your different attempts to fill the gaps in Medicare. Either something based upon previous employment or current employment, or a Medicare supplemental plan, or a Medicare HMO, Health Maintenance Organization, a preferred provider organization, a PPO, or a Medicare fee-for-service plan or Medicaid. Next slide, please. Okay. Now you can give us a call. We are tax dollar supported under the federal government Administration for Community Living, New York State Office for the Aging in Erie County. We do not sell insurance. We are certified by New York State as counselors. I have 5 volunteers throughout the county that can help you. To the COVID-19, where it's kind of discouraging face-to-face presentations, we do handle phone calls, however. And we do publish, if people can read this, it is a comparison sheet between all the plans. Again, we do not sell insurance. It's plan by plan, what the co-pays are, what the deductibles are. We do with all the options for people that have Medicare to fill the gaps in Medicare. Realize that the #1 reason why people are in bankruptcy in this country is due to medical expenses. When Medicare came into existence during the Great Society, Lyndon Baines Johnson, it gave people over 65 that option to be insurable. Less people are able to get health insurance from their previous employer than in the past, as costs have gone up. So, but either way, ask us, we send you our comparison sheet. Numbers 858-7883. Due to COVID-19, we're kind of discouraging face-to-face interviews, but we will answer our phone Monday through Friday, 9 to 5. Okay. Again, we did not sell insurance. We are unbiased. We are certified by the state. Our training is from an outside agency. Unlike anyone else out there, we do not have sales quotas to make. We'll give you your options and let you decide what's best for you. Any questions?
Seeing a couple questions come through so far, and folks, feel free to type in your questions and comments to that Q&A, and hopefully the audio is a little better, so I do apologize for that in the beginning. Bill, the first question I'm seeing is, can you explain how the Medicare Savings Program works?
The Medicare Savings Program could pay your Medicare Part B premium. Sometimes it covers your Medicare Part A premium. In order to be eligible for the Medicare Savings Program, your net income has to be under $1,456 a month. In New York State, there's no resource cap, so you give any amount of money. And I said net income. So if your income is above that, you could buy other insurance, like dental insurance or a supplemental policy to drop your income under $1,456. Pays your Part B premium. At the lowest level, the QMB, which is $1,081 limit, would also pay your Part A premium. Most people do not pay a Part A premium. They've paid into Social Security, into Medicare for 10 years during their life, or their spouse has, so they don't have a Part A premium. But it could pay the Part A premium if you're QMB level. Additional benefit of having the Medicare Savings Program, and it qualifies you for full extra help. Extra help helps pay for your prescription drugs. So I'll deal with people that have very high prescription drug costs. They might be young and disabled, cannot get help from the state under the EPIC program. And first thing I'm going to look for is see if I'll get them into the Medicare Savings Program. It's a good thing. You call our number, 858-7883. We'll be happy to give you information about the Medicare Savings Program. And we also have our comparison sheets for 2021. They've been done. They have to be proofread. So we do not sell insurance. I'll give you line by line No pretty pictures, nobody swinging, having fun on a hammock or anything else like that, just the facts. And let you decide.
Just the facts, Bill. Thank you. The next question I'm seeing are, what should I be considering, or what are the important things to consider when picking a health insurance plan this year?
Important things to consider, number one, is what are your prescription drugs? Why are my prescription drugs covered and what will they cost me? There's 48 different Medicare Advantage plans that have prescription drug coverage. The costs vary from plan to plan. There's also 28 plans where you get Medicare Part D alone, called standalone plans. Make sure your prescriptions are covered, and then you'd want to see if there's any restrictions. The Medicare Advantage plans receive a set amount of money from the federal government to assume the risk that Medicare would normally have. So one of the ways they control their costs is by controlling their formulary, the meds that they will cover. A few years ago, a top-selling company lost a great deal of money. The following year, they raised their costs for their prescriptions. If you're getting the same amount of money if the person's healthy or not, it's kind of a disincentive for them to enroll sick people. Okay, when you lose $40 million, you have to do something if you plan to stay in business. So you want to make sure your prescriptions are covered, and you want to look for restrictions. They might have a prior authorization. For example, yes, we'll cover this medicine, but only if you try a different medicine different. Realize that the insurance companies get rebates from the manufacturers. So there's a financial incentive for the insurance company to keep their costs down. And so they might require prior authorization. They might limit the quantities that you can receive per month, or they might require you to try another medication first rather than what the doctor ordered. That's called step therapy. So first of all, make sure your medicine's covered. Make sure that what the restrictions are and if you can live with the restrictions. Some plans have restrictions, some do not. The most restrictive one, again, is prior authorization. That's where the doctors say, we're just not going to cover it. We will, but we're not going to cover it in your case. Also, if it's a Medicare Advantage plan, you want to make sure that the doctors are part of the network. As I mentioned earlier, under the HMO model, you must go to a doctor who accepts your insurance. The plans determine who is in their network. They can drop a doctor, or a doctor can withdraw. Every now and then, I hear a doctor won't be in the plan for the following years. A lot of times, they cannot live with the restrictions of the insurance company or what the insurance company is willing to pay them. So if it's an HMO model especially, make sure your doctors are in the network for next year. If it's a PPO, you have more freedom of choice, but freedom's not free. In many cases, since the insurance company doesn't have as much control, you're probably going to be paying more out of pocket than if you went to an in-network provider. So those are two big things. Make sure your insurance is covered, prescriptions are covered, and the doctors are participating in the insurance with the Medicare Advantage. 60% of people in this area have a Medicare Advantage. It's about triple the national average. Also, you want to make sure the plan is well rated. The ratings are from 1 star to 5 star. And most plans in this area have an average or better rating. The local plans are in the 4 star, and there's one plan, PPO's got a 5 star for next year. But again, if you call our number, 858-8526, I'll send you a comparison sheet between all the plans that individuals can get. We don't have group comparisons because they vary from previous employer to previous employer. So those are big things. Make sure your medicine is covered. See if your doctor participates, and then try to say, I've been doing this work since 1985, long time. And I find people that think they're going to be as healthy in the remaining years of their life as they were the first part of their life. It doesn't happen like that. A lot of people use their health insurance most of the last year of their life. Many times you're locked into a plan. If you have EPIC, elderly pharmaceutical insurance coverage, it gives you a chance to change your coverage once outside of the annual enrollment period, which is going on now until December 7th. So, and the major drawbacks with the Medicare Advantage is a lot of them do not cover infusion medications, and that's a 20% co-insurance with most plans. For next year, they must cover renal care. They have been not having to cover it since 2006 at least. However, a lot of these plans have a 20% co-insurance. The nice thing about the Medicare Advantage plans is that there's a cap for your out-of-pocket expense. Next year, the cap is $7,550, but at least there's a cap. Under original Medicare, there's no cap to your out-of-pocket expense. So I would not advise anyone to just have Medicare. So the main things look for, your prescription drugs are being covered, see if doctors in the network, and ask for our comparison sheet. If you usually work alone, I do have 5 very dedicated volunteers throughout Erie County, and I did have an aide who's remarkable in my office. She's Sue. You might get her twice a week, and we're both on Medicare. All my volunteers are on Medicare as well, so we know it firsthand.
Thank you, Bill. We have a couple other questions here.
Okay.
This question, I have a union insurance plan. My husband will be 65 in April. For the PPO through my insurance, we need a copy of the Medicare card for parts A and B sent 3 months before he turns 65. How can we do this? P.S. My wife has the insurance and I am in the insurance.
Okay, you will get a Medicare card from the Social Security Administration. You can go online at ssa.gov, go to menu, go to apply for Medicare, and you do this 3 months ahead of time. You could also call the Social Security Administration, but realize that they're pretty short-staffed. They're going to want to direct you to the Medicare, to their ssa.gov. Make sure it's ssa.gov as opposed to .com or anything else. And then go to menu, go to apply for Medicare. If you are receiving Social Security benefits, they will automatically enroll you in Medicare Part B. Part B is optional. If you're still working, or if your spouse is still working and you're covered by their insurance from a group, from their active employment, you can delay Part B. Part D is also optional. So the quickest, easiest way is to go online, ssa.gov. And it's best to do it 3 months ahead of time. If you wait till after the month of eligibility, there's going to be a delay in you getting the benefit.
Thank you, Bill. Next question. Is there somebody there who can help me understand and read the drug formulary? It's confusing to me.
Yes. If you were to call our number, 858-7883, we will go over the formulary with you and tell you, again, the quantity limits, if there's step therapy or prior authorization. So we're usually here Monday through Friday, 9 to 5. Again, 858-7883. Again, we do not sell insurance. So we're different than the brokers out there that get a commission or have sales quotas. I can be unbiased. So can Sue. And so are my volunteers.
Thank you, Bill. Next question. I am still working and covered under my employer's insurance. If I retire sometime next year, can I then apply for Medicare?
Yes. You can apply for Medicare within 8 months of leaving your active employment without penalty. Or you can apply for Medicare Part B and D right now. You want to do a comparison, see which way you're better off. Many people that are working are paying into their health insurance. As I mentioned earlier, Part A is usually paid for out of a trust fund that you've been paying into since you were working, either you or your spouse. If you've worked for 10 years or more, there's no fee for you, no monthly premium. Part B is 1/4 the cost of running the program, currently $144.60. And D is against 1/4 the cost of running the program. So you want to compare to see which way you're better off. But, you know, in my case, I'm actively employed, and I pay Erie County for my health insurance. I did not pick up Part B because it's less expensive than if I were to have Part B for myself and my wife. So you have 8 months to pick it up without penalty. If you wait longer, and I do run into that, I run into people that figure they're never going to get sick, and they try to get Part B later. You can only apply between January 1st and March 31st, and it will not be effective until July 1st. And there's a penalty of 10% of the current premium for every 12 months you did not have Part D coverage. Same way there's a penalty for Part D if you did not get it when you were first eligible, unless you had credible coverage being coverage by active employment, either yours or your spouse's. With the Part D, if you are a veteran, that's considered to be credible coverage for Part D only, not for Part B. So COBRA is not credible coverage. I'll run into people that say, you know, I waited 2 years to get Part B. I know I wasn't working, but my employer was paying the COBRA for me. And they want coverage in October. I said, well, it ran out. You're going to have to wait till January. It won't be effective until next July. So you can delay in some cases.
Thank you, Bill. Next question, can you explain Medigap?
Medigap is a marketing phrase. It's the same as your Medicare supplemental insurance. Under your Medigap, Medicare pays first. And the supplemental policies, also known as Medigap, pay second. Now that is different than your Medicare Advantage. Medicare Advantage receives a set amount of money from the federal government to assume the risk that the government normally would have. So it's either a Medigap or supplemental or a Medicare Advantage plan. Now, with the Medicare supplemental, some coverages can be much better than you would receive under a Medicare Advantage. For example, the 20% co-insurance for infusions and some cancer meds are usually picked up by Medigap or Medicare supplemental, where they're not paid for by the Medicare Advantage. So the Medicare pays first, they pay second. Your Medicare Advantage, all the money is paid, all the claims are paid by the Medicare Advantage product, not original Medicare. Medicare is accepted by most providers in this area, and a supplemental would then pay second. With the Medicare supplemental, you don't get some of the fringe benefits like gym membership, though, and you don't get dental. Each one has to look individually to see what your needs are. Like I said, I've been doing this for a long time, and in 1993, the Medicare supplemental Medigap became standard. Prior to that, I would run into people buying 2 or 3 plans to fill the gaps in Medicare, and it was wasting money. You know, so pretty much now you cannot buy a policy that is covered by some other plan. That's federal law. It's very confusing to a lot of people, filling the gaps in Medicare and Medicare itself. So your supplemental or Medigap, Medicare pays first, they pay second, as opposed to Medicare Advantage, where all the claims are paid for by the Medicare Advantage company.
Thank you, Bill. Next question. Can a doctor withdraw during the year, or do they have to stay in the plan for the entire year?
It depends upon their contract with the plan. Likewise, the plan can drop a doctor. So majority of them that I've run, people that were calling me lately saying, oh, my doctor, I've had this doctor all these years and he won't be in the plan for next year. So it depends upon their contract with the plan. But with the contract, the doctors are paid either a set amount or withholding. Another way the doctors get paid on the Medicare Advantage is for improvement in the person's health. So it's sort of a pay according to your diagnosis and the quality of the care if you improve. I've been getting calls from people that say, my doctor dropped me as a patient. I say, why did you drop you as a patient? I said, because I won't take the medicine he prescribes. Okay? Where they're getting paid according to performance, if they don't take the medicine, the person might get sick and get hurt the doctor in the law. So to make a short answer long, it depends.
Thank you, Bill. Next question, is Extra Help and Epic the same thing?
No. Extra Help, also known as a low-income subsidy, is a federal program. It's administered by the Social Security Administration. And it gives you a break on your prescriptions, drugs, on the Part D drugs only. Epic is elderly pharmaceutical insurance coverage. It came out in 1987 for New York State residents. You have to be over age 65 to get Epic. Some people are too young for Epic, and even though they're on Medicare, you have to be over 65. There's two plans under Epic. One is a fee plan, and if your last year's income was under $20,000, you would pay a fee for an individual, $26,000 for a couple. And basically, under Epic, you would pay no more than $20 for a 30-day supply of your medicine. So Epic, in order for them to help you, it pays second. So you must have a Part D plan. Again, I run into people that never thought they would get sick, and they will not have Part D. Epic allows you a special enrollment to pick up a Part D plan. And it could be a Medicare Advantage plan that you buy, and the Medicare Advantage must sell you a policy regardless of pre-existing condition. Like original Medicare, they must take you regardless of your health status. I should add here, the supplemental plans, or Medigap, they can penalize you for pre-existing condition if you did not purchase a plan within 6 months of eligibility for Medicare, and the only coverage you have is Medicare. I'm dealing with someone right now. He's requiring kidney dialysis, going to start next week, and he only has Medicare. So these could be very expensive for him, because the supplemental will pick him up with a penalty for anywhere from 2 to 6 months, depending upon the plan, where he's going to be stuck paying co-insurance for his dialysis. He's a young guy, younger than me. So.
Thank you, Bill.
You're
Next
welcome,
question.
Kate.
What is the difference between supplement and PFFS?
Okay, with your supplement, Medicare is going to pay second. Medicare is a private fee, is a fee for service. So the more the provider does, the more the provider gets paid. With a private fee for service plan, that's a Medicare Advantage plan. They also call them Medicare health plans. Depends upon the part of the country. That the doctor gets paid according to how much care they provide, like under original Medicare. However, they're under the supervision of a medical director who works for the insurance company. So the insurance company is going to determine who's in their group, who's in their network of providers. They find a doctor doing too much care, it's a good chance that doctor will not be in the group for much longer. And it won't be part of the plan. So you've got, the question is, are they managing care or are they managing costs? If you're getting a set amount of money per month, you have to make a profit in order to stay in business. And the incentive is to make as much money as they can. It's the American way. So these are things that you have to take in consideration. You also have to see, you have to plan for the future, where your future medical needs going to be. If sometimes you can change plan mid-year. For example, Epic gives you a chance to change from a Medicare Advantage to a supplemental. There'd be no penalty if you've had that Medicare Advantage for at least 63 days before you switched. So the major difference, to answer the question, under original Medicare, Medicare pays if it's customary and reasonable medical care without the oversight of a doctor who works for the insurance company or a nurse that works for the insurance company. Doctors are kind of in a bind. They get their license to practice medicine from New York State. Yeah, in some cases, they have insurance companies telling them how to do their job.
Thank you, Bill.
You're welcome, Katie.
Next question. Is the penalty for Part D forever, and is there a way to get rid of it if someone has that?
Yes, the penalty is forever. There is a way around the penalty if you're eligible for the extra help. And the extra help is based upon your income and resources. Or if you're qualified for the extra help by having the Medicare Savings Program. Again, the Medicare Savings Program income cap for this year, 2020, is $1,456 net. So you can buy a supplemental policy, drop your income down, get the extra help. It does away with the penalty as well. So if you're eligible for the extra help, they'll waive the penalty for you. And there's two ways of getting the extra help. One is by having Medicare Savings Program, and that's most people that I see getting it. And otherwise, if it's just eligible for extra help on your own, but that has a resource cap to it of $14,650 this year in New York. So it's not permanent if your income is low enough to qualify.
Good to know. Thank you, Bill.
Welcome, Katie.
Next question. I have Medicare plus New York State insurance, meaning the Empire plan. How do I get vision and dental care insurance?
This is for a state retiree. New York State years ago decided to cut out the middleman. The Empire plan is where New York State self-insures. You would need to compare to see what you get from the Empire plan and what it costs you as opposed to what you would get on the open market. I don't do with group policies. You've got a group policy. During your open enrollment period, you'd want to compare what you can get as a state retiree. In this area, last time I checked, only about 26% of people can get health insurance from a previous employer. You are one of the fortunate ones. And that number is dropping. Every year, I get calls from people that are saying my employer's pulling out at the end of the year. They're dropping the coverage for retirees. And they don't have any union contract or whatever to guarantee them coverage. So in your case, you want to compare what else is available to you as a retiree in the group and compare that to outside. If it gets very expensive, some of the Medicare Advantage plans do provide prescription coverage for dental, vision, and hearing as well that are not required under original Medicare. They do have some additional benefits. They must provide it by their contract with the federal government. So in your case, you want to see what, during your open enrollment, check with your Human Resource Department, your personnel, to see what's available to you, and then compare that. So if you want a comparison sheet, we'll be more than happy to send it to you, which you can get on the open market.
Thanks, Bill. Next question. What is AARP, and do I need that?
AARP, American Association of Retired Persons, sells health insurance. They get a stipend. They receive money from United Healthcare to brand their name with it. Many years ago, they used to have a contract with Prudential. Do you need it? As I said earlier, you just don't want Medicare. it doesn't make sense to have Medicare alone because there's no cap to your out-of-pocket expense. I've dealt with people that had thousands and thousands and thousands of dollars they had to pay out of pocket because they just had Medicare alone. So I would get something. AARP through United Healthcare sells HMO, PPO, as well as supplemental. We do have comparison sheets between all the plans, and some plans are less than competitors, some are more. But I would never just have Medicare alone, unless you're a veteran and get your benefits from the VA hospital. It's just too dangerous. Big risk out of pocket, big expense. So they advertise extensively too. So AARP, the drawback is you have to be 50 years of age in order to get their insurance. I was dealing recently with a 38-year-old woman who's got Lou Gehrig's disease, a very nasty disease, very expensive. She's gotten Medicare because she's got Lou Gehrig's, and that AARP would not be an option to her because she's under age 50. So they're just another vendor.
Okay. Thank you, Bill.
Welcome.
We had a question coming through if we can send out the cost comparison sheets. Bill, do people have to contact us directly, or can we email those out or mail those? How does that work?
They can call us directly. They can email me, and we'll mail it out. So Sue in my office is working very diligently on them. We have them completed. However, I do not have them proofread, so you will not get it this week. And hopefully next week or the week after. This has been a very difficult year to get the information from the insurance companies. A major one just got the information last week, for example. We'd never get the information before October 1st, and it's very tedious work. You can call us at 858-7883. Leave your name and address. Also, we try to screen for extra help. So if your income is above $1,619 a month, just say it's above it for an individual. And if it's for a couple's income, it's about $2,100, let us know, and we'll try to screen you. It's also in our directory here. When we mail this out, we do a screening to see, if people are eligible for the XL with their prescription drugs or the Medicare Savings Program. I'm in a fortunate position where I work on salary. I don't care what you buy. I can be objective and honest with people. I don't have any sales quotas to meet. Neither does Sue. And of course, my beloved volunteers work for free. They just do it for the love of the work. So, okay, so call us. If you want to email me, it's Daniels, W, DANIELS, W, at Erie, ERIE.gov. But even if you want to email me, I can help make things easier for you if you give me a list of your medicine and the dosages. And I can narrow down your choices for you. So it's Daniels W at Erie.gov or William.Daniels at Erie.gov. Either way, it'll come to me. We mail out hundreds every year. It's a government service that your tax dollars are paying for, and it's all black and white. No sales involved in anything with it, and you make your own decision.
Thank you, Bill. I'm not seeing any other questions. I'm not seeing any other questions right this second. So if anyone has any last minute things, please go ahead and type those in. Otherwise, Bill, my question to you is, can you speak a little bit about what else your unit does in addition to providing this health insurance information?
Well, we are federally funded as an area agency on aging. So we provide an information assistance line, which provides people answers to many problems that older people encounter. We have grants to help people pay for home care. We have grants again from the federal government to deal with Meals on Wheels. Our mandatory is an information and assistance line, though, information referral. We usually have 5 staff on, and they're all trained to do what I do as well. And that's our main thing. That main number is 858-8526. Again, it's 858-8526. And anything that relates to senior care or younger people as well. They'll answer the phone, New York Connect. So if you're a disabled person, younger, we can help you. Give us a call. We're friendly. We're here Monday through Friday, usually 9 to 4:30. That line, 9 is 9 to 5.
Okay. Well, Bill, thank you so much for your time this morning, and thank you to everybody who's on with us. We are recording, as you know. I'll try to post this later on, and I'm just so appreciative for everybody being here, and Bill, for everything you know, so you can help everybody else, the rest of us, sift through this.
Thanks, Katie. I appreciate the opportunity to be part of the University Express. Thank you very much.
Well, you're welcome. I'm going to stop recording.